Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuvir Deshpande, would like to welcome you all in my Ayurveda Academy YouTube channel. As you know that I am MD in Ayurvedic Medicine and MD in Ayurvedic Physiology. For paid online consultation, you can definitely WhatsApp on 922681060. My dear friend, nowadays I find that many of the people are complaining of the backache, neck pain, leg pain, and very tired after some physical work. And many allopathic doctors, they usually advise the patient to do perform vitamin B12 blood test and also calcium and vitamin D test. And finally, the output is this particular complaint, that is osteomalacia. So today we would like to discuss something about osteomalacia with natural Ayurvedic remedies. So let us discuss about this osteomalacia. You can see here what is the composition of the healthy bones, and this density is becoming less when there is a osteomalacia. Basically, it is related with the calcium and vitamin D. And in Ayurveda, we have the Praval pishti vati tablet, which is very useful this particular condition of osteomalacia. But before that, let me tell you something about causes and the symptoms and what else we can do for this osteomalacia. Osteomalacia is a condition where bones become soft and weak, not because of the wear and tear like arthritis, but it is due to the problem with the bone mineralization, especially the lack of vitamin D. Let us think of your bones are like the bricks. And if there is no cement, then naturally these bricks fall apart easily. So what is this cement? This cement material for the bone is calcium, phosphorus, and vitamin D. This osteomalacia is very common in adults. But of course, in some malnourished children, this condition can happen with these bones, and that particular condition is called as rickets. So what rickets is in children, that becomes the osteomalacia, the similar condition in the adults. Now, what are the causes of osteomalacia? Number one, vitamin D deficiency, which is the most common cause of osteomalacia. Then there is a lack of sunlight, not proper exposure. Of course, we are in India, so sunlight is ample. But the problem is how many people are taking the advantage of morning tender sunlight. I am not talking about the sun in the afternoon at 12 o'clock, at 1 o'clock. No, it is a morning tender sun rays are very important for the formation of vitamin D. Then there may be some kidney or the liver disorders which can affect your vitamin D production or the calcium absorption. Then in the children especially, malabsorption is also common because of the undernourishment. But in the adults, it is because of the colon disease. That means large intestine, if the person is suffering from ulcerative colitis, or if the person suffering from the small intestine problem like enteritis, then also there is a problem of absorption of calcium. Now, some people are has to use the anticonvulsants for the problems like epilepsy, or some people are having the problem like GERD, gastroesophageal reflux disease, or hyperacidity, and they are consuming antacids for a longer duration. The medicines for anticonvulsants, longer duration. Then these particular allopathic medicines sometimes has the side effect of that type of the deficiency of calcium or vitamin D. Now, vitamin D is acting like a key to unlock calcium absorption. And without this, the bones cannot stay strong without the calcium. So vitamin D is affecting the calcium absorption, and calcium is necessary for your bone density. Now, what are the signs and symptoms of osteomalacia? Number one, bone pain, especially at the hip joint, lower back, and also both the legs or unilateral right or left leg. Then there will be muscle weakness, difficulty in walking, difficulty in standing up. Then the bones become fragile. and a small trauma or small fall in the bathroom or anywhere else, that becomes a lot of fractures in the body. Then there will be waddling type of the gait in the osteomalacic patients. Now you can see the symptoms of osteomalacia. For example, painful bones, humerus and joints. This is the elbow joint. Then there will be muscle cramp sometimes. Then muscle pain at bicep or tricep region, weakness and difficulty in walking because of the pain over here. Now, if you are having osteomalacia, what type of the investigations are necessary to perform? Number one, blood test. There will be low vitamin D amount. Then there will be low calcium in the blood, low phosphate level, but there will be high alkaline phosphatase. Okay? If the patient is asked to do the radiological investigation, X-ray of the bone, then there may be looser's zone, which can be called as a pseudo fractures. Then the important test for osteomalacia is bone density scan, which is also called as a DEXA. Then there will be urine test to check sometimes calcium loss or the phosphorus loss. Your doctor may also test your parathyroid hormone level, which is called as a PTH hormone, to rule out other bone disorders. Because you try to understand PTH and calcitonin. These hormones are acting like a antagonistic. For example, this PTH hormone is maintaining the blood calcium level, and calcitonin, this particular hormone, maintaining the calcium in the bones. But both are working, what you can say, the very friendly level. And if one is less, for example, blood calcium is less, then the bones are providing the calcium. If bones are having the less calcium, blood is giving the calcium to the bones. Now, the common question, how we can prevent this osteomalacia? Number one, daily sun exposure, minimum for 15 to 20 minutes, around 7 to 8 or maximum 8, 9 a.m., not after that. Eat food rich in vitamin D, for example, eggs, fatty fish, or fortified milk. Then calcium-rich foods like milk, cheese, and leafy vegetables. But cheese should be in moderation or in a low level. If you are already having dyslipidemia, you should avoid the cheese. Then regular exercises also help to get the calcium and vitamin D level at a normal optimal level. Avoid the long-term antacid or anticonvulsant overuse. That means you can discuss with the doctors how many months, how many days it should be consumed regularly. Intermittent break will be very beneficial. Let the sun be your medicine, which is a tagline for osteomalacia. Early morning sunlight is best for vitamin D. Now, what can be the allopathic management? The doctor will give you the vitamin D3 supplement. For example, cholecalciferol. Then calcium supplements can be given, treating the underlying cause. For example, if the person is suffering from kidney problem or liver problem, then naturally renal function test, urea and creatinine should be maintained at normal level. If liver function test, for example, bilirubin level, then SGOT, SGPT, alkaline phosphatase, always you should have the look how that particular investigating levels should be maintained at a minimum standard level. Then if the pain is very severe, then naturally doctor has to give NSAIDs, that is what you can say, the non-steroidal anti-inflammatory drugs. It may be like Combiflam or Voveron. Doctors may start you on the high doses of vitamin D weekly or monthly depending on the deficiency level. Next is Ayurvedic management. According to Ayurveda, osteomalacia is linked to the asthikshaya, that is bone tissue depletion, and because of that there is a vata imbalance, vata dosha imbalance, that is called as a dhatu kshayajanya vata prakop. So naturally nourishing type of the treatment is given. Ashwagandha, which always strengthens the bones and muscles. Shatavari balances the hormones and support the absorption of the calcium. Gugulu, Laksha Gugulu, anti-inflammatory and supports the bone healing when there is a fracture. Then Hardzod is a type of plant, medicinal plant, Cissus quadrangularis, which always helping for bone mending herb. Dashamula is vata balancing type of the 10 roots. Then Panchakarma, whenever there is a vata problem, Ayurveda never forget to give the medicated enema, which is called as a basti or the vasti for the chronic cases of osteomalacia. Then sun bath encouraged by Ayurveda also for natural healing. Now, diet tips for osteomalacia: warm milk with turmeric and ghee or shatavari kalpa. Include sesame seeds, almonds, and leafy greens for the recovering from the deficiency of calcium. Avoid the cold, dry, or spicy foods which can aggravate the vata. Lifestyle tips: do yoga poses that will improve the bone strength. For example, Tadasana, Vrikshasana, and Sun Salutation or Surya Namaskar. Avoid the smoking, which nicotine also causes the vasoconstriction, less blood supply, and the problem becomes more dangerous or worsening. Then stop alcohol, stop taking the junk food. Maintain the healthy gut for nutrient absorption. Remember, healthy bones mean a strong body. Osteomalacia is always reversible if diagnosed very early. Combine the power of modern medicine and ancient Ayurveda for the best results. So, my dear friend, this is all about the osteomalacia, and we will discuss further what you can say the small diseases or the complaints in each video. So, are you fascinated with this video? Are you getting what you can say happy with information? You like this video? Then definitely I request you please make thumbs up, share it with your friends and family, and subscribe to Ayurveda Academy channel for more such natural health solutions. I wish stay healthy and stay natural. See you in the next video. Thank you very much, and I wish all the best. Take care and see you in the next video. Thank you.